I'm going to go ahead and get started. Good evening, everybody. Welcome to our webinar hosted by myself, Natasha. I am one of the mid-level providers at Austin Urology Institute with Dr. Kushak Shah, which is the main, the big boss over at our practice. And tonight I am super excited to talk to you all about peptides. So this is who I am. I am a board certified clinical nurse specialist. As I mentioned earlier, I am practicing at Austin Urology Institute. I know some of you probably got the link from our website, may or may not be patients. Some of you may have been referred from other people and things of that nature. So just in case you didn't know, that's where I'm working. And tonight's focus is on men's health and wellness, or at least that's my focus in general. I'm really super passionate about it, and peptides in particular are one of my most asked about topics when it comes to the wellness space. And you will hear me talk in reference to guys a lot tonight, but peptides are not only for men. In fact, we were talking about this earlier today. Peptides can be for any gender, men or women. In particular, for tonight's theme, though, given the upcoming weekend and it's Father's Day, we're kind of, marketing to all the dads out there to sort of get good and get right. As far as I do have a quote on there, empowering others to thrive, not just survive. So just say that out loud to yourself, guys. Empowering others to thrive, not just survive. My passion in this wellness space is really just to have those conversations with patients. And, we're on this earth for a short time. You want to make it a good one. You want to live your best life. And whatever that means in terms of optimizing and having good quality of life, that's my goal. So I'm super passionate about that for sure. So a little introduction. Again, happy early Father's Day to any fathers on the call tonight. This one's kind of for you all. I'm just wanting to take the opportunity tonight to talk about all the things that make us feel good. Energy, recovery, muscle, sleep, libido. I mean, literally all those things are probably what most people want in life to feel good and live life. In terms of specifically peptides, the biggest question is, well, what are they? Lots of people often don't know what peptides are. They hear about peptides through this, that, or the other. And so tonight I am here to talk about peptides, mostly from a surface level, very basic introduction. So a little teaser, if you will, nothing too crazy, mostly talking about peptides that I provide for patients in our practice. And there will be time at the end for some question and some Q&A. So if you have any questions along the way, feel free to throw them in the chat, but I will address them at the end. So let's start with the answer to what are the peptides. So they're short chains of amino acids. They're naturally found in your body. Tonight, we're going to talk mostly about human growth hormone peptides. I will mention some other peptides too as well at the end. But think of peptides as messengers that tell your body to do things, specifically with release of a growth hormone. And the reason why they're so popular today is just because they're so targeted and effective. They have low side effect profile. And often in this sort of new age era, people are all about, wellness and anti-aging and better performance and all of those things. So peptides are really kind of on that wave in terms of providing all of those benefits for people. So that's why they're so popular. And I'm going to talk to you about the different kinds that we use here in our office. So a little brief history of peptides. Oftentimes people are like, oh, I don't want to do anything that's kind of like new or it hasn't been around or anything like that. These peptides have been talked about since the 1970s. Lots of them have been patented in the 1980s, 1990s. And then from the 2000 onward is really when we started to sort of catch on from a wellness standpoint, looking at research where peptides are affecting aging, fat loss, healing, that kind of thing. So in terms of its historical content, definitely been around for a while. It's not a new kid on the block by any means. Common question that I often get is the HGH versus HGH peptide. So you've probably heard, and oftentimes in conversation, they can get overlapped. HGH injection is used for the diagnosis of growth hormone deficiency. So usually this diagnosis is made at adolescence, and those patients need synthetic hormone because their body is not making growth hormone, and so they have to be given hormone, almost similar to like testosterone replacement therapy. If your body's not making enough of it, or not making it at all, you're replacing it with testosterone. Similar here with the HGH injection. We are not providing that. That's not what I'm doing. That is often an expensive drug. It has high side effects, including enlarged organs, cancers, things of that nature, and it's banned in sports, so you often can't use it in that setting. So I'm not diagnosing anybody with that growth hormone deficiency or anything like that. I'm merely offering it as a wellness additive. The HGH peptides, it stimulates your own growth hormone production. So we all are already making growth hormone. When we give ourselves the peptides, we're telling our body to make more of it. Okay. So we're not replacing it or anything like that. Oftentimes the peptides are more affordable, lower risk, obviously, low side effect profile. And most peptides are not banned in areas of sports. So again, this slide just kind of reiterates the nature of what a peptide is. It's an amino acid. It tells your body to make more of the growth hormone, specifically HGH peptides. You'll hear me talk later on this evening about other peptides, but with this, you're telling your body, it mimics its natural signals and tells your body to make more of the growth hormone. The fact is, everybody makes it, and it peaks in our 20s. So, that's probably when most of us were feeling great in life, is in our 20s, because our growth hormone is doing everything it's supposed to do. At some point, it starts to decline. So about 14% per decade. And after the age of 30, most people will start to feel that decline. And in terms of symptoms, like what kind of symptoms do you often feel when you have low growth hormone? It's usually fatigue, increased belly fat, poor recovery, low libido. Some of you are probably saying, that sounds pretty familiar with other things. And it is. Symptoms often overlap with other things, specifically another hormone that some of you are probably familiar with, called testosterone, right? So, when you have low T, it's like, oh, I feel tired. I have low libido. I can't get rid of the belly fat and all the things. So when I tend to offer peptides is usually once we have optimized your testosterone levels, or if you're a patient whose testosterone levels are within normal range for your age bracket. And so if those things are aligned, peptides are going to be sort of a good solution to that. So optimizing testosterone, whether you're on TRT or you're taking something like Clomid to optimize your testosterone level, and you just haven't really reached some of those goals in terms of body composition, maybe still having issues with sleep, things like that. That's when I tend to talk to you about the peptides. And then again, like if you're someone who's maybe not needing testosterone, or you're already doing well from that standpoint, or really not even ready to talk about testosterone, then I can offer you HGH peptides. And oftentimes we see that, those symptoms improve even in patients that aren't on testosterone. So it's a viable option for either scenario, for sure. Next slide here. So IGF-1 and what its relationship with HGH peptides. So I'm using this slide to define this because later in another slide we'll talk about it. So I want you to kind of understand what this really is or what it means. So IGF-1 is like the middleman that helps your body grow and repair itself. The growth hormone that we all are already making is like the boss that tells your body to do those things, grow, stay strong. But the boss isn't directly going to tell your body to do it. So it tells your liver to release the IGF-1, and then the IGF-1 acts as a messenger and does the job of the growth hormone. So building the muscle, repairing the tissue, supporting brain function, all those type of things you're going to see when your IGF-1 is optimized. So why does it even matter? What does that mean? Well, it helps you recover faster from workouts or injuries. It supports healthy aging. And when IGF-1 is low, it can mean, things like fatigue, poor recovery, or slow healing. So let's meet the peptides. These are sort of our top peptides that we use in practice, or what I use in our practice. Sermorelin is probably the most popular peptide. It's usually what I call the gateway peptide because it tends to be probably, in terms of finances, the least expensive peptide, but also a very effective peptide. It boosts the growth hormone release from the pituitary gland, which is in your brain to help release growth hormone and then initiate the IGF-1 release and telling the body what to do. Epimorelin also does the same thing. It has minimal effect on cortisol and prolactin levels than some of the other ones. So it's a good secondary one as well. CJC 1295 is another one that people often ask me about. It has a longer half-life. It works really well with epimorelin in trying to help with lean body muscle mass and mood stabilization and sleep, things of that nature. Now, tesamorelin, say that 10 times fast. That one is actually FDA approved for reducing visceral fat in HIV-associated lipodystrophy. So there's a lot of clinical studies with this particular peptide because of that reason. It is really good in patients who are looking to reduce abdominal fat loss, what we call that stubborn gut fat. However, it tends to be quite pricey. So when you're looking at peptides and you see it on the list, it's going to be the more pricier one, but it is more potent and, again, very specific to the abdominal fat loss there. So when we talk about peptides, we kind of talk about what your goals are and different things of that nature. Again, sermorelin, a very good first-time choice. If it doesn't really do the trick, we can always do what I call stacking of the peptides. So we add two peptides together. As it said here, CJC 1295 and epimorelin is a good stack together. They just work, some peptides work really well together to optimize whatever goals you're looking to achieve. So scientific backing, right? So I talked about some studies and things in the last slide. That tesamorelin study that I mentioned earlier is up there. 15% reduction in visceral fat in 6 months. That's awesome. And this is just one of many. There's been so many studies specifically, again, in that population of patients. But anecdotally, I can say that it's worked really well on patients that I've prescribed it for. So, and then the sermorelin trials, remember that IGF-1, that messenger that's doing all the work, sermorelin tends to improve the IGF-1, helping with bone density, muscle mass, increase in sex drive or libido. Also, you see here, sermorelin patients tend to see a reduction in body fat of 5 to 8%. So pretty good there as well. And IGF-1 increases 30% in men with sermorelin and 23% in women. So remember, we need that IGF to be, optimized or elevated so that it goes and does all the work. It helps to repair the hormone and plays a key role in maintenance of, youthful appearance, healthy body functions, giving you more energy, all of those type of things. So super important, again, really popular peptide of the HGH family is the sermorelin. Benefits. So I've probably said benefits of HGH in every single slide. here it is again for you. You know, increased collagen production is not on here, but that's also another thing that it does. So who doesn't want better hair, skin, and nails? I mean, come on, right? Improved sleep, mood stabilization, brain fog is another one. There's peptides that I'll talk to you about that help with joint support as well, and increased libido. So various benefits and very popular for that reason. So what might you notice in terms of a timeline with these peptides? Because that's another question that guys or anybody will ask me when we start the peptides. Well, friends, this is not a wham, bam, thank you, ma'am. The peptides, patience is progress. So it's going to take a little bit for you to see some noticeable changes, but it's definitely worth it. And you know, I say that from clinical experience and patient feedback. About 2 to 4 weeks, you'll probably start seeing some subtle changes. Maybe mood is better. Maybe you're sleeping a little bit better. At 8 weeks, you tend to see maybe the libido's up. Maybe you're in the gym and you're recovering better and faster. And then somewhere around 12 weeks or 3 months time frame, you're at that fat loss. The body composition is changing. You're starting to see those ripples in your arms that you want to see, muscle tone, all those kind of things. So definitely, you know, give it the good college try when you're on these peptides. It's not just a 1 month deal. You've got to invest at least, you know, 3 months in order to see some sort of progress. I'll talk to you later about cycling with these peptides, because that's what people do. Once your body tells your, once the peptides tells your body what to do to make those, to make more of the growth hormone, those receptors are activated. So you don't need to be on peptides forever like you would be on testosterone injections or something like that. You just need to be on it for, you know, a period of time. So oftentimes on average, I tell people 6 to 9 months is reasonable. Then you take a hiatus, you come off of the peptides for a couple of months. I have some patients who like to do peptides during the fall, sort of winter time frame, and then they're off for like spring and summer, which makes sense if you're trying to get your body right for all those outdoor activities. Definitely something that you're investing sort of a long-term commitment to in terms of the peptides, just to see some benefits. And when I say long-term, I don't mean forever, but enough to get something out of it. It's not going to be overnight. So who should avoid peptides? What population of people should stay away from this? Well, if you're wondering if that's you, active cancer for sure would not go there, especially anybody with a history of hormone sensitive cancers, definitely not a good candidate for that. Uncontrolled diabetes or severe untreated sleep apnea are ones, just because some of the peptides, Semarelin specifically, can increase your glucose levels. So if you're someone with uncontrolled diabetes, probably not a good way to go with you. Now you can be a diabetic as long as you have controlled blood sugar levels and somebody's monitoring those levels. We just don't want to make anything worse. Okay. And then as far as the sleep apnea, I would say with the if it's untreated, not great. If it's under control, you might be an okay candidate for that. The pregnant or breastfeeding, we just don't have enough scientific data on how it affects pregnant women or women who are breastfeeding. So it's just a population of people that we just kind of want to stay away from for that reason. And similar to the active cancer stuff, we just don't know how it's going to help or hurt that population of people. And then obviously known hypersensitivity to any peptide ingredients. Most people won't know that they're hypersensitive to it until they do it. So, you know, what's common, and we'll talk about administration here in a second, but if you inject the peptide and you have a little bit of itching and some redness, that's super common and normal. If you inject the peptide and your body breaks out into a rash and you can't breathe, that's definitely not normal, duh. So seek emergency care if that happens. But if that does happen, we tend to say, let's stay away from the peptides for that reason. So common side effects, mild mild water retention. Some people might say they feel like they're gaining a little weight and feeling a little bloaty or something like that. I don't often hear it a lot, but it is a possible side effect. Headache or even flush feeling, when especially when you're starting out, but those kind of things tend to go away. Injection site irritation, as I mentioned earlier. More serious things would be the elevated blood sugar, as I mentioned before. We don't want to make anything worse from that standpoint. So if we check the labs and you maybe didn't have an elevated blood sugar before and now you do, we may need to have the conversation about stopping the peptides, or even closely monitoring it. Carpal tunnel like symptoms, never had anybody have that, but again, this is under the rare. And then elevated IGF-1 levels. So I will say I don't routinely check IGF-1 levels for a couple of reasons. It's pretty pricey, and I'll tell you later in a slide that peptides are not insurance covered, and so this is all out-of-pocket expense. So if you're doing IGF-1, the test itself is pretty pricey and oftentimes not necessarily needed unless indicated. So if I feel like we need to check your IGF-1 levels, then maybe you're having some weird symptoms or something, we can check it. But if you're feeling good and you're not having any side effects, we won't be overly concerned with the elevation of that. We stay within a normal sort of lower range when it comes to the amount of units that I provide and things of that nature. So again, looking at different things, but very rare when it comes to those below. So how's it taken? Pretty simple, unless you're scared of a needle. But this is a tiny needle, tiny little needle. And it's called a subcutaneous injection because it's going into the subcutaneous fat. So if you see there on that picture, that needle's going straight into it. Typically, you're just going to pinch that area in your belly because it's easiest to give it in your belly. If you're afraid to do it yourself and you want somebody else to do it, they can do it in your belly, or they can do it on the back of your arm where there's some subcutaneous fat as well. You're oftentimes going to start on a Monday through Friday, or at least 5 days a week, 2 days off type of thing. And that can change depending on your symptoms and your goals. I don't often increase dosing just because the data shows that an increased dose in this medication doesn't give any net benefit. So it's oftentimes I'll add a day. So if you go 5 days, we'll add a 6th day and see if that kind of changes things up a little bit. But the dosing is pretty standard overall. And then, of course, protocols combine lifestyle. So I want you guys to continue to eat good, work out, and sleep, and stress management. If you're somebody who just wants to start peptides to see if it's going to do something for you, but you're not going to do something for it, then it's probably not the best way to go. It's always going to be paired well with just, active, being proactive in lifestyle modifications and things of that nature. So monitoring and follow-up. I told you earlier about blood work that's needed. I often just like to check in on your glucose and your liver function just to make sure. Remember that growth hormone is telling our livers to release that IGF-1. We just want to make sure it's not affecting any liver function. Your glucose levels aren't super elevated or anything like that. IGF-1, again, just kind of on an as-need basis. It's not necessarily indicated. Some patients might say, well, I just want to know what my IGF levels are. Okay, we can check them. That's not a problem, but it's not required. And then adjusting of dosing, like I said earlier, it's going to be based on symptoms really. And then obviously if you're having some weird reactions or elevated glucose levels or something like that, we'll need to make some changes to dosing and things of that nature. We talked about the periodic breaks and the cycling in previously. Again, 6 to 9 months, off for a little bit, back again, just depending on what your goals are, what you're looking to achieve, that kind of thing. Always under provider supervision. I cannot reiterate this enough. Just because peptides have become so popular, every Tom, Dick, and Harry is selling these peptides, okay? Online, in the gym. on the corner store, like everywhere. Okay, so you want to make sure that if you are interested in peptides, A, come see me. Duh. But B, that it's under provider supervision if it's not me, right? So, you want to get the best product. You want to make sure that somebody's monitoring your labs, looking at symptoms, if you have questions, things of that nature. It's just important to be supervised when you're on these peptides, even though they're, low side effect profile and not much damage can happen in theory. It's still very important to know that you're getting the right product. If you come see us, we use a local pharmacy, and you have the option to pick it up at the pharmacy, or they can mail it to your home, which is next day delivery. Processing, I usually say 5 to 7 days processing time, just in case. But oftentimes patients get it a lot sooner. But yes, in general, you want to make sure you're getting a great product. Our compounding pharmacy is third party vetted and all the things. So, we're not giving out trash out there. And when it comes to peptides, okay, so just make sure that you think about that when you're looking for peptides. Again, another slide just to reiterate, peptides, lifestyle, peptides aren't magic. They amplify your efforts. Pair it with, stress management, good sleep, clean eating. Resistance training is often recommended, but not required. Any type of just exercise, whatever that looks like for you. And, if you're not in the gym era, then that's fine. Just, any kind of workout where you're staying active is going to be super important to help amplify the peptides and how they work. Is it legal? So if you think back to the first slide, yes, it is. What we're providing is a peptide. It is legal when it's prescribed for appropriate use, and not covered by insurance, like I mentioned earlier. Unfortunately, because I'm not diagnosing anybody again with any kind of diagnosis. This is all for wellness. So we're not submitting this to insurance. It's just an out of pocket coverage. And then available through compounding pharmacies under a provider guidance, as I mentioned before. So that was all HGH peptides. Lots to take in, right? The kind of theme is that, they help with lean body muscle mass, increase collagen production, weight loss, that kind of stuff, sleep. So now we're going to talk about different types of peptides, still peptides, but we're going to just tag a little bit on this. PT141, I'm calling it the libido booster, y'all, because this is a medication that helps boost that libido up, because who doesn't want good libido? It's how it works is it stimulates your melanocortin receptors in your brain. And so fun fact, this peptide was actually originally studied for tanning purposes. So they were doing these studies using PT141, and all of their participants were starting to ask about or starting to report a lot increased libido, and sexual activity had increased, and all the things. So I just think that that's super funny that it started out that way. And that's because that melanocortin receptor is increasing your melanin. So a side effect of this is a tan for people who need it. And so in that sense, PT141 is very much popular, and anecdotally, I've seen it work very well for a lot of people. It boosts sexual arousal and libido, even in those patients that have tried like Cialis and Viagra and have not done really well with that. The PT141 is just a viable option that you can try. Different mechanism, right? It's not in the bloodstream, it's in the brain. But guys have said they like PT141 even over Cialis or Viagra. So don't sleep on the PT141, okay? On here, it says its effects kick in within 30 to 60 minutes. That's actually very variable. Unfortunately, some people don't get an effect for several hours after. So what I say is that if you're going to try the PT141, try it first for funsies. And then if it doesn't work, then, I mean, if it doesn't kick in, at least you're clocking when it's kicking in is what I'm trying to say. So the onset may be a couple of hours, but then when you use it for real, you'll know that you need to take it, you know, maybe 4 hours or 6 hours before. So very good option. It can be taken nasal spray or injection. Don't ask me which one is better. I think I've gotten good from both sides. Nasal spray works really well, apparently, in females, and then injection better in males. It's a toss up. I just say if you don't want to do an injection, you can try a nasal spray regardless of gender. And then it can be used as needed as well. That's usually how I recommend it. And it can be used in men and women, like I said before. So PT141, if you're looking to boost your libido, and other things haven't worked, or even you're just starting at the beginning, that's definitely a good way to go for sure. So the GLP-1s, so we can't forget about our weight loss powerhouse. Everybody knows about them: semaglutide, Ozempic, Wegovy, all those super popular weight loss medications. Well, in our setting, we use it as well. Obviously from a clinical standpoint, we're going to be looking at a lot more things in terms of like your health and how it can help you. If you're someone who's super overweight and trying to lose weight, and you're at risk for cardiovascular disease and those type of things, this medication can be super helpful. It slows down your digestive system, so you feel full faster and longer, and it supports fat loss and helps with insulin control. Sometimes people just need help with cutting those cravings, or they're emotional eaters or something like that. These medications tend to help out in that arena. It's a once a week injection. Again, here it's a tool. Put it in your toolbox as a tool. It's not a magic fix. So it's going to always work best when you are eating better, exercising, and all of the things. When I talk about providing this particular medication to patients, I often say, if you're someone who's eating 4 slices of pizza, this is just an example. If you're someone who eats 4 slices of pizza and off of a GLP-1, and then you start a GLP-1 and you still eat, and you're still eating pizza, you may just go down to eating 1 slice of pizza, because again, it's slowing down your digestive system, so you feel full faster. But then if you keep eating that pizza, when you get off the GLP-1, they call it rebound weight gain, because you never change your habits while you were on the medication. So it's very important to, again, make it keep it as a tool in your toolbox, and do all the other things that can help you in terms of diet and exercise and things like that. So very effective, as you probably all know, but when it's in the right hands of the right people, it can help for sure. BPC-157. This is probably one of my favorite peptides if I'm choosing. I know mommies are not supposed to choose favorites, but it is. Sorry, guys. So what is BPC-157? I'm calling it the healing peptide because it's a powerful peptide. It was actually originally found in gastric juices, and helped people who were having issues with like gut issues, GI related stuff. And then they saw that it helps reduce inflammation and can speed up healing with tendons, ligaments, joints, all that kind of stuff. This medication can be taken by injection or orally. I believe our pharmacy only has it in the injection form, I think. But that's what I know it to be used as. You can use it in 2 different ways. BPC-157, if you have like an acute injury, you can use it almost like someone would prescribe antibiotics to you. So it would be like, take this injection. Let's say you have a knee injury, a knee that's bothering you. You inject BPC-157 twice a day in that knee for like 10 days. And that's supposed to help promote healing, reduce inflammation in that area. And then hopefully you feel better pretty quickly. I've had patients swear by this stuff. I myself want to purchase BPC-157. I keep meaning to, but haven't. So it's definitely on my list. But the other way that you can use it is sort of like prophylactically on a maintenance dose schedule where you're injecting every day. And this can help sort of just in general with trying to be a protector of healing and neuroprotective benefits, mental clarity, mood, those type of things. So it's a pro tip here is that if you stack it with other peptides, specifically HGH peptides, it can enhance recovery and performance. So you can be working out, feeling, younger, better workout regimen and those type of things as far as performance. So BPC 157, definitely a good go-to if you're somebody with like chronic ailments or even acute things that are kind of flaring up as you're, working on yourself. So there's no right choice here. There's only what works for you. And what I mean by that is that I presented tonight so many different peptides to you all. Some may be like, oh my God, I want to use that, but should I use this or should I use that? We can personalize the peptide protocol for you. You talk to us about what your symptoms are, and we can try to figure it out. We can, it's an investment, right? So I told you this is not something that's paid by insurance. So oftentimes, if you're open to trying a peptide and seeing if it works, lots of people do that and really are satisfied with their choices to do so. So, book a consult. We'll get some baseline labs. We will talk about what your goals are, and then we'll find, what's the best sort of peptide for you. As you can see, there's tons of them. So hopefully I have been able to provide you with a little bit of an introduction tonight with some of the peptides that I use and hit you with some of my favorites. And hopefully tonight you have learned a lot or a little about peptides. And so now questions are definitely welcomed. I think I'm at 6:40 time frame. So if there's any questions, I will start answering them now. And yeah, just good luck to everybody in your health journey, if that's what you're looking for. All right. So I have a couple of questions here. Is there a test to indicate we have low growth hormone and can benefit from HGH peptides? Yeah. So that is, that's that growth hormone peptide that I was referring to. Growth hormone lab test is variable. So it's not the best test to see if, your growth hormone is low or not, because you're never going to get a really good answer from it, because it's going to vary depending on the time of day, if that makes sense. So that's why we look at IGF-1, like I mentioned earlier. So the IGF-1 lab test is something that we can look at to see what your levels are. We can do a baseline, and then we can do a follow-up one to see if it's improved. But again, that test can be pricey. So oftentimes we just, start the peptides, and then if you feel better, then we know that it's working. We don't necessarily look at like a lab. And another reason for that is we're not diagnosing you, remember, with growth hormone deficiency. You shouldn't have growth hormone deficiency at this stage in most of who I'm talking to is live. And so if you did, you'd already be diagnosed with that. So I hope that answered that question, John, about that. But IGF-1 would be the only one that would be beneficial to check. And then we could look at it from a baseline to after you've started. BPC 157, useful after surgery, for example, after a joint replacement. Yes. I definitely think that it help post-surgery. I even think there's some orthopedic doctors out there that are getting excited about the peptides, and they use them in conjunction if they have access to it. So yeah, if you have a joint replacement of a joint or something of that nature, it definitely BPC is a good way to go for sure. Yes. What does a consult cost? I don't have insurance. I don't have the answer to that question, John. But if you can shoot me your email, I can have email. I can have somebody reach out to you to give you some information on that. Unfortunately, that's not my area of expertise, but I can definitely get an answer for you. And other question, approximate monthly cost for peptides. So yeah, so that's a good question. It's going to depend on which peptide you use. It starts anywhere, I believe, from like 150. Don't quote me, but somewhere between 150 and 300, depending on which one you use. Sermorelin is going to be in that ballpark of the 150 price bracket. And then that tesamorelin is going to be a little bit higher. And I think BPC 157 tends to be a little bit higher. PT 141 is usually reasonable, somewhere in between that as well. And so, yeah, as far as a monthly cost, it's going to vary depending on the peptide, but just as a range, that's probably what I would say. Okay. Any more? Oh, we got one. Is HCG considered a peptide? No, it is not. So HCG is something that we use for patients who are trying to optimize testosterone, or patients who are trying to get pregnant, either male or female. We use that. It's actually very hard to get these days, actually. So in our setting, we just don't use it anymore because the pharmacies we have just don't have it available. But if you're looking to help with like testosterone usage, then I would say similar product would be Clomid or Inclomid. Hope that answered that question. But good question. Okay. I think that is all the questions. Thank you, everybody, so much for joining the call tonight. These are my sources. Oh, I got another question. And I'll be on for the next, 5 or 10 minutes. So if anybody needs to get off or anybody has just another question, I'll hang around for a little bit just to answer some questions. Do you do lab work as part of this process? Yes, Bobby, we do. So we would get baseline labs to kind of see. And again, depending on what your goals are, we'll talk about which panels might be best for you. So if you're looking to look at all hormone levels, like testosterone, cortisol, vitamins, we have like a men's wellness panel that we can start you off with. And you can, if you have insurance, you can use insurance for the labs for that type of thing. When I mentioned earlier about IGF-1 particularly, it's that there's not like an associated diagnosis code for that insurances will probably cover for that particular lab. So it is likely to be an out-of-pocket coverage for that. For the labs that we would do like in the beginning to start you off with, those are typically mostly covered with insurance. So we have different panels for that, but we definitely do lab work as part of that process, for sure. I think we have some people kind of dropping off, and that's fine. Like I said, I'll be on for probably until 6:50 or so, just to kind of see if anybody wants to ask any questions. Yes. Okay. Yeah. Are the peptides fulfilled through a compounding pharmacy? That was another question that was in here, and yeah, the answer is yes. Have a local compounding pharmacy that we use. And so, like I said, it's local, so you can pick it up if you needed to, or they can mail it out to you as well. And to anybody who maybe have gotten on late, we will have this presentation available on one of our platforms. likely our YouTube platform, so you can review it. If you missed anything or had any other questions, you're welcome to view on there as well.